tremendous progress is being made on a vaccine for COVID-19. Multiple pharmaceutical companies, including Moderna, Johnson & Johnson, and others, have started trials for vaccines currently under development, and some are showing promising results. Current estimates put the date of completion for vaccine at 12 to 18 months, which sounds like a very long time until you realize that vaccines usually take 10 to 15 years to develop. So what is the science behind COVID-19 and vaccines?
A vaccine usually involves a weakened or dead version of the virus or bacteria. When the vaccine enters the body, the immune system mounts a defensive response and produces antibodies made specifically to combat said disease. When the actual pathogen arrives, memory cells will recognize it and produce antibodies, allowing the body to pin down and destroy the threat. These vaccines are effective, but they take 10 to 15 years to be developed, and we simply don't have that time with COVID-19.
Enter the RNA vaccine, an experimental type of vaccine which uses a specific part of the virus's RNA. Upon entering the body, it causes certain cells to produce viral spike proteins which let the immune system produce antibodies against the target virus, essentially allowing the body to produce its own vaccine. Unlike traditional vaccines, RNA vaccines take a much shorter time to be developed and produced. Though they are still largely experimental, RNA vaccines have shown great promise in testing trials so far.
After vaccines are tested on animals, there are 3 phases of testing on humans. The first phase involves a small number of healthy participants to find out if the vaccine is safe and does what it's supposed to do. The second involves a randomized trial of hundreds of participants to see if the vaccine is effective at immunization. The last phase may involve thousands of participants and is when the right dose and potential side effects are identified. These steps usually take a few years each, but the COVID-19 trials are estimated to take a much shorter time due to emergency workarounds such as starting with human volunteer trials, among others. Naturally, this sped-up process has brought up some ethical and medical concerns.
It could be a year at best before a COVID-19 vaccine is developed, but until then, practice social distancing, take precautions, and do your part in flattening the curve. This has been Vinh Nguyen with Code Blue News.